Welcome to the Roots podcast presented by Elite Anesthesia, where we dive deep with dental professionals about the challenges, breakthroughs, and stories behind their successful practices. Today we have Dr. Jordan Swarbrick with us, an oral surgeon with Riva Dental Implant Center. Dr. Swarbrick, welcome.
Good to be here. Thanks for having me.
Yeah, we've known each other for a while. Elite and Dr. Swarbrick specifically, we've worked together since you moved to Utah. Is that right?
Yeah, pretty much. Yeah, we go back probably pushing 4 years now, doing cases all over the state of Utah, and just keeps getting better and better.
I remember we started off doing like thirds with you.
Yeah, started out in some offices that I was providing coverage for, just doing mainly wisdom teeth and full mouth extractions, occasional, implants. And at the time, I was doing the sedation myself. Had a few assistants that would travel with me. It was a traveling, type of situation, and we weren't real happy with that situation. I was doing the sedations. The assistants were great, but hadn't really been trained in sedation, and having to bring all of our equipment, all of the meds, everything, and we just thought there could be a better way to do it, which is when I found you guys and reached out. And after the first case, I was hooked, and I've been stuck with you.
I've been with
you guys 4 years, 4 years since, and multiple states, multiple practitioners now working with you, and always great experiences. And most importantly, from the beginning, this is my mindset. Everyone at Riva, it's what's best for the patient, and I really truly believe this is the best thing for the patient, the best way for a patient to have the procedure done, and the safest. And that's one of the main reasons why we continue to work with you guys.
Yeah, well, we obviously agree. And we've had a great time working with you. We've had a great time working with Riva. And just to reiterate, very similar feelings. We work with implant centers and dental surgeons everywhere and all different walks of life, different practices, and always been incredibly impressed with you and with Riva. And I can say from personal experience, and then Elite as a business, we've always felt like patient safety comes first. And I would say that you as much or more than anyone have always recognized that, and it means a lot to us, and I think means a lot to your patients and to your business too.
Yeah, exactly. Thank you so much for saying that. Yeah, it's something that we not only preach but we implement, and that's why this partnership works so well. I think we put the patient first. Put the patient's experience, comfort, safety first before anything. When we were in the process of creating the clinical workflow that we follow at Riva, me and several of the other doctors sat down and said, okay, if these were only family members or only really good friends, how would we want them treated and what would we do? And that's how we outlined the process. And it started with, doing sedation the right way. I can do the sedation. Do I want to do the sedation now, or do I feel like I should be doing the sedation? No, I feel like there's a better way. And so it's something that I love offering to our patients. As you know, many of these patients, they have not been into the dentist for years or decades because of dental fear. And their teeth and their oral hygiene has suffered because of that. And so when they come into our office and we can let them know, you're just going to take a nap. You're going to take a nice, comfortable nap. And when you wake up, everything's going to be done. You can just feel and see that stress, come off their shoulders that they've been carrying, because they just are terrified of having dental treatment done. And so it's so nice that we can offer that. So nice that these patients that have been, neglecting their oral health now can have it treated and end up in a better spot because of it. So for many, many reasons, we're very appreciative of the service that you guys offer, and for the results that it allows us to give our patients.
Yeah. We talk to these patients as well, and it's reciprocated. They know that Riva is all about safety. They know that Riva cares most about them, and that means a lot to us too. We definitely see both sides, and we just overall really enjoy working with you guys for that reason, amongst others. Can you tell me a little bit more? You've said a lot about doing it the right way. I think that's kind of a controversial thing. Can you tell me a little bit more about what that means?
Yeah. My interpretation of it, as I mentioned, I can do the sedation. In certain situations, there's patients when it's a light, mild sedation and it's a quick procedure, it's a little different situation. In this type of situation that we're dealing with, where it's a procedure that's going to last more than an hour. It's a procedure that's a little more invasive. It's something that, if I were to do the sedation, not only does the procedure end up taking longer, my attention cannot be fully directed at the surgery and the patient. I'm going between the sedation, the procedure, the medications, having to monitor everything at once. It's basically doing one person doing two jobs is what it ends up, being. We're actually the only specialty out there that does their own sedation and the surgery at the same time. And so when we change that, and when I can just focus on the surgery, when I can be more efficient with the procedure, it leads to faster procedure times, quicker recoveries. It's been shown time and time again, a lot of these complications occur due to, prolonged surgery times and infections and things like that can occur when it takes a lot longer than it should. And so I can work on, becoming more efficient with the surgery, fully, concentrated on what I'm doing with the implants. And I know that not only will the surgery go better, but there is a specialist right there at my side in elite anesthesia that this is all they specialize in. This is what they do day in and day out. And they are 100% focused on the patient, on their comfort level, on the depth of sedation, on their vitals, making sure everything goes smoothly throughout the procedure. And having seen both situations firsthand, I choose specialist monitoring and taking care of each specialty item with the procedure, which is an oral surgeon performing the surgery, anesthesia provider in elite, a nurse anesthetist or anesthesiologist handling the sedation. And then also for us, the third part is a prosthodontist managing the prosthodontic side of the procedure, which is the teeth and the bite and all of that. We just see time and time again, when specialists handle the specialty portion of the procedure, you have better outcomes, better success all around. So that's what we preach.
Yeah, I think it makes sense that putting the right people in the right place, doing what they were trained to do, creates the best outcome for the patient.
It's
overall.
Crazy, right?
Yeah, it makes sense. It's not too complicated.
Yeah, exactly.
It is fun. Not everyone's committed to doing that, and I think there are various reasons for it. I think it's important, for anybody watching this to understand. Riva is a dental implant center, specializes in all X procedures. These are or can be long cases, and as you mentioned, these patients often are not the healthiest dental patients that come through the door. And so I think it's important to kind of differentiate or categorize the patients that you guys are actually seeing, and to specifically talk about anesthesia and in general why it's important to have specialists dealing with complicated patients. They're just in general kind of unhealthy.
Exactly. Yeah. Due to the demographic, due to many situations going on. And as we know, oral health is so tied to systemic health. And these patients that we're seeing, they're seeing us because of their oral health situation and it having declined and being in a bad situation and in a bad spot. And so a lot of that can transition to and translate to other systemic issues and comorbidities that we're dealing with. And so, sedation's tough enough when you have a healthy, healthy young patient there in front of you. When you have a patient with some health issues, it just becomes that much more, don't want to say complicated, but more challenging. And that's why, that's when we call the specialist.
Yeah. Your background, you are an oral surgeon. Where did you do oral surgery residency?
Yep. So my quick background, I did my oral and maxillofacial surgery training in Indianapolis through IU Health. Mm-hmm. We covered all the main hospitals downtown in Indianapolis, and you receive training in every aspect of oral and maxillofacial surgery. Trauma, cancer, dental implants, dental alveolar, extractions, third molars, things like that. And so great background in the surgical aspect. And then also we receive training in the anesthesia portion. So for, 8 months we're there with the anesthesia residents, giving sedation and performing procedures on the sedation side. And so even with that background, and I feel very comfortable performing a sedation.
Yeah.
Now, when I perform a sedation and do a surgery is when I've started to realize there's a better, more efficient, safer way to go about doing it.
Yeah. Tell me about, so obviously residency did both things, anesthesia and the surgery portion. What was it like getting into practice and actually having to marry those things together?
Yeah, we obviously, did several cases in residency as well. We were doing the extractions, dental implants with the anesthesia. And so we do train that on that before you're released into private practice. But it's I think as you will talk to most practitioners, general dentists, specialists, anyone, the anesthesia can be the most stressful part of your day-to-day life. And that was probably one of the biggest things for me, and the most impactful things is as I was traveling initially, as we talked about, to all these remote locations, the most stressful part was performing the anesthesia. And it would keep me up late at night, have trouble sleeping before cases just because, you think you're dealing with a healthy patient. Next thing you know, you're into some issues with anesthesia. And so
healthy as far as they tell you.
Healthy as far as they tell you, exactly. And so removing that stress and removing that portion of my responsibility for the day, and I still am there and helping when I need to, but being able to focus just on the procedure was a significant improvement in my work-life balance.
Yeah. I mean, speaking about oral surgeons specifically, I've noticed as we talk to oral surgeons that are maybe a little later in their career versus newer surgeons that are fresh out of residency or still in residency, the feeling about having a third party come in and do anesthesia seems to be slightly different.
Just so I'm clear, I think we're on the same page.
You're on the younger side.
Do you notice that the older surgeons are kind of stuck in their ways?
I think they have more concerns, more questions about it, and they've been doing it their whole career.
Yeah.
I mean, from our standpoint, we don't take a side. Like, elite anesthesia is not trying to say that the oral surgeons shouldn't do anesthesia. That's not at all the position that we take. I think there's a use case for anybody, specifically with the oral surgeons that are later in their careers, that are experienced and have been doing this, and they know the game and know how to do it. I feel like the use case is, like you were saying, patients are getting more complicated. They're sicker than they've ever been. Drugs, marijuana use, that kind of stuff is more of a factor. And so there is a use case for bigger cases, bigger surgeries. Maybe for thirds and smaller cases, it doesn't make sense. But in the younger surgeon population, it feels more like, I don't really want to do this at all. I'd rather you guys handle all of it.
No, it's a really, really interesting point you bring up, and you definitely do see it. As you mentioned, you spoke to it a little bit. Some of these surgeons, they've been doing it for 30 years. They've been doing it day in and day out. And for those young, healthy wisdom tooth, third patients, I think some of them are a little hesitant to change. They have something that's working. And you know what? In that situation, if you're comfortable, if it's working, like you're saying, they can continue on, and it's probably going to, continue to work great because it's worked great for 30 years. The second that, you get that unhealthy patient in the chair, and I would say the second that surgeon starts to, get a little nervous with the case, hey, you got someone you can call, the second that get referred that all-on-X case from your local provider, and it's going to be a 3-hour case. I don't care who you are and how long you've been doing it. No one really wants to do a surgery and a 3-hour sedation. And so now they got someone they can call. And so, like you said, there's always a situation where it makes sense. But for the folks who've been doing it a long time and are a little bit stuck in their ways and want to continue doing it, they can do that as well. But if there is a better way, and if it's a chance that it makes your life better, I always tell them at least give it a try.
I don't want to talk about anesthesia the whole time. We want to hear about Riva and about you. Tell me, it seems like for especially oral surgeons, seems like one of the bigger questions about using third-party anesthesia is the economical aspect of it. Does it make sense for me to now pay somebody else to do this, or for my patient to pay somebody else to do this? And we usually talk about, increased efficiency, increased, better surgical outcomes and that kind of thing. But can you speak just a little bit to the economical piece of it?
Yeah, it's a good question. It's something that, occasionally we get asked from providers that are considering using you guys. And to your point, there are groups out there that require the patient to pay for the anesthesia directly. We wanted to create a center and an environment where the patient feels like we are taking care of them every step of the way. No surprises, no fine print, no, nothing like that. And so when they decide to move forward with us, we take care of the anesthesia no matter how long it goes, and we take care of that so that they feel that and they feel they're taken care of. With that, it provides efficiencies, as we mentioned. So we're able to get them in and out of the chair much, much quicker. And it's not that we're rushing. It's not that we're flying through things that we should be taking more time. It's just that we can fully focus on the procedure. And so it's huge in our process and in our workflow, because our patients are leaving the same day with a set of permanent teeth. And so the faster that we can get the procedure done and that our lab can fabricate the teeth for us to then place in the patient's mouth and fix to the implants, the faster they get home and start resting and recovering. We see that with this process and with their increased efficiencies, patients are recovering quicker, less pain, less swelling, just benefits them all around. And so for those reasons, the additional cost is completely worth it for us. We have most of our patients will mention it to their friends. A lot of their friends are in their similar situation. And so we get a lot of referrals because their experience goes so smoothly. And so why penny pinch on something that could be so impactful to that patient and make everything go so much smoother, and in the long run lead to additional volume and business for us, just because we're taking care of our patients the right way.
Yeah. So and potentially money lost in the future dealing with complications or
exactly
poor surgical outcomes that you got to deal with later.
No, 100%. So yeah, really, really hard in our minds to imagine doing it any other way.
Yeah. That means a lot to us. Like we genuinely care about the patients that we work with, care about the outcomes.
It shows.
And not just for the patient. Thank you. Not just for the patient, but for you too. Like for you, for the people that work for you, for the assistants, just overall feels like a better experience with it than without it.
100%. Yeah. For every team member that's in the room, the patient, their family seems to, family member that's dropping them off the day of surgery seems to, just be able to rest a little easier knowing that they're in the care of multiple specialists handling each part of the procedure. So yeah, it's like you said, it's very few scenarios where we could ever imagine, not doing it this way.
Yeah.
I should say no scenarios because we love it. So
tell me about working with Riva, as an oral surgeon.
Yep.
Riva has been a great company. We've really enjoyed, working with them. What is it about Riva that's different?
Like we mentioned earlier, the experience is so important to us. Doing our best to really provide the absolute best patient experience is what we're after. And with that comes, specialists for each portion of this. There's a lot of centers out there that are doing this, trying to learn how to do this, and they just haven't received, in our minds, the proper training. And so what I love about Riva and why I love working there is there's a surgery portion that trained oral surgeons take care of and are responsible for. There's a teeth portion, the prosthodontic portion, that trained prosthodontic specialists are overseen and responsible for. There's the anesthesia portion that our team in Elite Anesthesia is overseen and responsible for. There's the lab portion that we have a specialized lab that helps. And so again, we're really big on specialists doing specialty things, and we think that's one of the reasons that a lot of our patients do end up coming to us, and that we see such great outcomes. It's just for some reason in the dental world, it's not as clear as in, say, the medical world. You never go to your general family doctor for a heart procedure, heart cath, and for some reason in dental, it's not quite as clear. And so we really like that we're keeping that clear and having specialists do specialty things, and then also just the culture. the people that we have there, the staff, everyone truly, truly loves and cares for these patients, and you can see it day in and day out, which is one reason we love working with you guys. You can see that you guys truly care for these patients. I'm receiving text messages later that night from your providers after they've done a case. Hey, how did Bob do after surgery? Wake up okay? He's doing okay. He's such a nice guy. I mean, you don't see that elsewhere all the time. And so love working with staff that wants the best for the patients, that celebrates the patients, and yeah, just wouldn't do it any other way. It's love working there.
I can personally attest to both those things. We've worked with Riva as well for a long time. And as I think about what makes Riva different to me and to our providers, I think that's what stands out the most. I think as a business, we feel taken care of by Riva, which is unique. We work with a lot of people, and I can't say the same about everyone. And I've always felt like you guys care about our relationship more than anything else. And that business is tough. Everyone's got different motives, and I think Elite at the core is trying to take good care of patients, good care of dentists, good care of the people that work with you guys, good care of our own employees. And I think I've always felt like Riva's the exact same. We've always aligned on those things, and it's been an awesome, easy partnership.
No, it's reciprocated for sure.
So dental implants changing a whole lot over the last, we'll say 20 years, but especially probably over the last 5.
Yep.
What at Riva have you guys adopted technology-wise that has kind of furthered your practice more than anything else?
Yeah, it's interesting you say that, because even in the last 4 years since we've been around, there's been a lot of technological advances that mainly benefit the patient. And so we're always working with who we view as the top, companies in the dental implant world, on the implant side, on the digital scanning side, all the 3D technology, and are in the process of testing some of these products for these companies before they even come to market. We want to make sure that if there is something else available that improves, the patient experience, the outcome, that we implement that immediately. And so we've already, had things that we've implemented that weren't around 4 years ago, but some of those things are the new scanners. As you go between, offices and see the different scanners out there, we feel like the digital technology that we have and the digital workflow is the absolute best that a patient can have right now. It minimizes the time in the chair, increases efficiency and accuracy. These new scanners are incredibly, incredibly accurate, which ultimately leads to a very, very nice natural fit of the teeth, and a set of teeth that looks natural, feels natural, and allows patients to function the way that they should. So all the digital technology that we have, we believe is the best that you can get right now. And any chance we have to improve that, and as we mentioned, as these products come out, we do what we can to change our workflow as needed to implement anything better that's coming to market.
Sounds like Riva's about the best people, the best specialists, the best technology, completely humble about all of it. I think as a patient, if you go to Riva, you expect to have as good of an experience as you could get anywhere else, or better.
That's the goal. And everything, again, all these decisions that can be made for multiple reasons, the reason at Riva is the patient, and that's what we love. It's the patient, it's the patient outcome, and so that they can look in the mirror at the end of it and smile and say, yes, this is my smile, these are my teeth, and feel overjoyed that they have them. That's our goal. So
if my mom needs implants, I'm going to say
appreciate it. And we have done several family members that are staff at Riva, and being able to do that and help those family members, it's one of the best feelings. And the selfishly as a provider, the gratification that comes from helping a patient go from being edentulous, without teeth, or from having just a mouth full of broken down teeth, to having the best smile in the room and being able to eat steak and vegetables again. It's just nothing else, in my opinion, compares to that in my field of oral maxillofacial surgery. Out of all the things that I could be doing, I knew early on in my career this is what I wanted to focus on, because of because of it being such a life-changing procedure, because of this ultimately changing the direction of these people's lives. It's such a fun thing to be a part of, and love, day in and day out, being able to help these patients.
So I've been doing this almost as long as we've been working together, about 5 years. And I had no idea how impactful your smile is. I had no idea until we started doing implant dentistry and working with dentists, working with oral surgeons. All-on-X specifically is just incredibly impactful. And same thing for me, like the gratification that I get from facilitating these procedures as an anesthesia provider. Number one, they're super nervous during the day, which is that's always part of anesthesia. Everyone's nervous for any type of surgery. That's something that I love about anesthesia. But usually in a hospital, they're getting a colonoscopy or something. You don't walk out of your colonoscopy feeling like you do after getting a whole new smile.
Right. It's a very unique and different feeling. As I mentioned in my training, there's a lot of things that an oral maxillofacial surgeon can do. And again, just in my opinion, nothing compares when you give that patient that final set of beautiful teeth. It's like immediately they look in the mirror and you can see in their eyes, they know their life has been changed. And we see them, they're getting better jobs. They're back out dating again. They're in the gym. Like it just all the other things start coming together.
It's like a catalyst for everything else they do in their life.
You see them a year later and you hardly recognize them. You're like, are you working with a company that we work with? Or, oh no, you're a patient. It's like, and yeah, it's just the funnest thing to be a part of and to use our skills in that way to help these patients. And so absolutely love it. Never plan on stopping. And again, such a big part of it is, this relationship, doing it right, doing it in a way that is safest for the patient, so that they can use these teeth afterwards. We got to do what's right and what's safe, so that they that they can actually get the teeth and use them.
What do you think the long-term vision is for Riva and for you in your career? Like, what are we hoping to do over the next 5 to 20 years?
Yep. My wife occasionally asks me the same question, and I am
same.
Yeah, exactly. And there's surgeons that do these all-on-X procedures for a while and then shift to something else, and they go back to the hospital. I never see myself doing anything else besides this procedure. It utilizes all of my surgical skills because it is a more complex, intricate procedure, which I like, much different than taking out wisdom teeth. And so I love the procedure. I love what I get to do for these patients. The satisfaction that it brings me as a provider. And I love working with Riva. Riva is a company that I think, they believe in doing things the right way, and I love being a part of that. I love helping them grow and help other surgeons learn how to do this that haven't had as much experience. And so I see myself doing that, for the foreseeable future.
Riva has always been easy for us to root for. You guys have always done things the right way and treated us well, obviously treated patients well. I'd say, we get a lot of feedback on outcomes from both patients and, just being in the community, and Riva is very, very well regarded. And it's good to hear. We're grateful to be associated with you guys.
Oh, that's great.
Jordan, I could ask you questions all day. We could talk all day. I think we're out of time, but I really appreciate you coming around.
Of course.
You've been one of our greatest friends, associates, allies throughout our time here at Elite. And I hope it's reciprocated. I hope you guys feel the same way.
100%. Yep. Let's just get those mountain bikes out and hit the trails.
Scare riding. You can show me how to shoot.
Exactly. Thanks so much.
Thanks, man. Yeah. I appreciate it.
Yeah.